Yeah, well, what I want to see, and I think what the American people have an appetite for right now, and I think if you ask most Americans, what are Republicans offering the country in terms of alternatives to debt deficits, health care, et cetera? I don't think they know what the answer is. Now, some of us that follow this really, really closely, we might know about Tom Price's alternative to health care. A few of us that are really, really into this, we can explain the penny plan. We can explain health care savings accounts. Certainly this audience can do all that. But they're not communicating to the American people what their alternative solutions are. And I think the people are craving leadership. And I think this is a missed opportunity to explain what we need to do as a country and what happens if we continue to go down this road of record deficits, unfunded liabilities, et cetera.
Yeah, and I think part of the problem is a lot of the Republican solutions, which have been good, have been passed by the House already, but they're sent to the graveyard of the Senate and they die, and they don't garner as much attention as they should. But the answer is freedom of choice. Their solution limits your choices and says you can buy 4 insurance plans. Our plan would have infinite choices and would let you buy any kind of insurance you want, and ours would actually let you keep the doctor of your choice or the insurance of your choice, but ours would also allow for competition, and ours would allow for lower prices. The problem with Obamacare is it limits your choices and actually makes you buy more expensive insurance.
Well, it's unbelievable. I think the country has begun to realize that every promise the president, Democrats made about health care is a lie. But now we find ourselves in a position where there's very little we can do about it. And this budget funds health care.
Yeah, and I think it gets actually worse over time, though. I don't think the president can escape this even within a year. Even he realizes this. He's trying to delay some of the pricing that will come out next year till after the election. But my understanding is that insurance companies will have to file next spring and summer. And I think when they discover that young, healthy people haven't signed up and only the very sick have signed up, the premiums are going to go through the roof, and you're going to find next year that even before the election, most of the people who have been canceled and are trying to get insurance will get sticker shock, and I hope they take that sticker shock and that anger to the polls with them.